Okay, hello everybody. My name is Michelle Navarro. Today I'll be presenting on the health topic of electronic cigarettes and adolescents. So the overview of our health topic today is that electronic cigarette devices are increased use. It's on the rise within our adolescent population. It's the convenience, accessibility, and flavors that are attracting our youth to this product. The FDA did their yearly National Youth Tobacco Survey, and in 2018, 3.6 million youth were reported currently using an electronic cigarette device. In 2019, on that same survey, more than 5 million youth reported currently using an electronic cigarette device. The CDC reported that 5.6 million youth we're currently using electronic cigarette device in the year 2019. And the majority of those who are using an electronic cigarette reported using the product Juul. Juul, they have these little devices that contain the nicotine or flavored tobacco product. And within one little Juul pod contains enough nicotine, which would be relatively equal to a pack of cigarettes. So, why adolescents? 9 out of 10 people who smoke tried their first cigarette before the age of 18. 98% of regular cigarette smokers tried their first cigarette before the age of 26. And flavored tobacco products currently are more appealing to the adolescent youth, which causes them to try to tobacco product. Contributing factors for our youth using tobacco products or specifically electronic cigarettes is the social media is a big factor. The easy accessibility, peer pressure, peer influence. If peers can pressure you to use these products, or the peer influences that you see those within your class or school or people you are close with using these products, you'll be more enticed to use them as well. Some of the contributing factors that make this an important health issue is that nicotine um, affects adolescent brains differently, and it can make them more dependent on nicotine a lot sooner than it would on an adult brain. Another contributing factor is that if a parent uses these products, they are more likely, based on their social norms, to use a tobacco or e-cigarette product as well. And again, it's the accessibility, availability, and the price of tobacco products that can make these more interesting for adolescents to use. Some of the harmful effects are that e-cigarettes are becoming more popular over time, and flavored tobacco products, they are more appealing and they are safe to consume in the sense of like edibles and products like that. However, it is a lot more harmful to inhale these flavored products. It goes straight to the bloodstream through your respiratory system. So it has been seen that it can cause possibly more harmful side effects down the line. And the vapor does contain toxins that can cause cancer and lung disease, similar to tobacco products. Recently, in October of 2019, there was the first study that linked e-cigarettes to cancer. And in this research, it was done on mice, and it was done over a 54-week period. And these mice did develop lung abnormalities along with carcinogens in their lungs and abnormal bladder cell growth. Another harmful side effect is, well, overall, that electronic cigarettes also do contain nicotine. They do affect the development of an adolescent brain, since our brains do not develop until the age of 25. Nicotine does affect the part of the brain that controls our attention, learning, mood, and impulse control. nicotine in adolescents may also increase their risk factor later on in life to develop addictions to other drugs. And within the CDC, it's reported that about 50% of calls to the Poison Control Center are for kids ages 5 and younger, due to getting into the product of someone in the household that it's not properly put away, and they ingest the liquid in the pods or in in the little pods that are attached to the e-cigarettes. So that's currently one of the bigger calls for poison control, is due to infants' ingestion of the e-cigarette products. So the severity of the issue is, I'm just going to move this on over here, that as we can see over time, there's a big increase in high school and middle school use on the graph, with electronic cigarette devices. And also in the FDA research done in CDC, those who reported using electronic cigarettes, 97% of them reported using a flavored tobacco product with the electronic cigarette in that month of the survey. And in 2017, 11% of high schoolers used an electronic cigarette. Also in 2017, 0.6% of middle schoolers used an electronic device. And then if we move on 2 years down to 2019, 27.5% of high schoolers reported using an electronic device, and 10.5% of middle schoolers reported using an electronic cigarette device. So that would equate to over here that more than 1 of 4 high schooler students would use an electronic cigarette device. Comparatively, 1 out of 10 middle school students would be using an electronic device. So if we look at the graph here, we can see that over time, with the red and the gray charts, we can see a steady increase. And then in 2015 and 16, there is a decrease in use for high schoolers and comparatively middle schoolers with electronic devices. And over time, between 2017 and 2019, there is a drastic increase in electronic device usage. If we look at regular cigarettes used by the same age groups, we can see with high schoolers, there's a steady decline in usage of regular cigarettes, and middle schoolers, you can see as well, just a steady decline in usage as well. Some of the recommendations that I would suggest, just due to the drastic increase in tobacco usage amongst adolescents, is that parents and role models not use tobacco products themselves, and learn about different types of risks that tobacco products and electronic cigarette devices cause to their overall health. For healthcare providers, they can ask specifically about electronic cigarette devices when they're doing tobacco screening, because a lot of times people do not associate vaping or using electronic cigarettes as the same as cigarette smoking. And then they can also warn the youth about the health risks involved. Schools can adopt and enforce tobacco-free campuses. I know there's a lot of campuses that do have the no smoking policies. However, I know more on college campuses, they also do have these policies. However, they're not reinforced. There are a lot of, even on CSUN campus, there's a lot of signs, but you can see people smoking right next to the sign, even though it says do not smoke, or it's a smoke-free campus. And also reiterate that electronic devices are also a part of the no smoking policy. States and communities can prohibit smoking in electronic smoking devices in use in workplaces and some public places. There are some cities like Burbank where it's a smoke-free city. However, again, there's still people who go around and smoke, so it's not really enforced. However, it is a law. And the same as some hospitals have within a certain distance around the community. But or hospital, you're prohibited from smoking. And also letting them providing that education of secondhand smoke when it comes to smoking devices, on how that can affect other people other than themselves. Because a lot of times we can know it's a problem and it may hurt our health. However, we don't think about how some of our actions that we take can affect others and their health as well. I'm sorry. Restricting and banning flavored tobacco products. Currently, there is Massachusetts, which is the first state to ban flavored tobacco products. So we can follow in their footsteps, along with currently there is a House Bill HR 1498, which is trying to implement nationwide a ban on flavored tobacco products until we can see if it doesn't cause as much harm, there's not as much chemicals, and it reduces, we provide more restriction on how people get access to electronic devices since they're not as strongly controlled as regular methanol cigarettes. We can also improve identity and age verification for online purchases of tobacco products and e-cigarette products as well. So this is, again, another health issue within our community that we're facing just due to e-cigarettes is still fairly new product compared to regular cigarettes. And we do see a drastic increase within our youth population and their access to these products. We want to educate them and provide as much, in a sense, support to provide the proper education and restrictions to adolescent youth, since we can see in the statistics that the numbers are increasing. However, we want to be able to implement and limit their access to these products. And here are the references, and that is it for my presentation. Thank you. I don't know how long it is.